Events are planned over the weeks ahead to support people living with brain aneurysms. To tell us about the challenge and what's planned is the Executive Director of the Brain Aneurysm Foundation, Christine Buckley. Thank you very much for being with us,
Hi,
Christine.
Chris. Thanks for having me.
As always, we have to start out by reminding our viewers what exactly is an aneurysm.
Well, a brain aneurysm, it's a weak spot in the vessel in the brain, and it's almost like people refer to it sort of like an outpunching on an inner tube as a tire. So it's a weakening of the vessel, and with constant blood flow, it bursts out into that aneurysm.
Now, we hear some very scary stories about people who die suddenly at almost any age from this, and I guess also that medical response in the immediate aftermath, or right as it's happening, is critical.
Yeah, it's true. So the stats are 1 in 50 people are walking around with an unruptured brain aneurysm. 30,000 people a year rupture. About half those people die. And then 7 out of 10 of the other half have some kind of disability. So knowing you have an aneurysm ahead of time before rupture is key. Early detection is a large part of our mission. And you're absolutely being in the right place at the right time and having someone, if that rupture does occur, to have treatment as quickly as possible at our center where they're accustomed to treating brain aneurysms.
Well, I know you're desperately looking for advances in treatment. You recently went to a presentation about that before the Federal Drug Administration. Tell us, what is happening as far as any kind of new promising things out there?
I mean, there's a lot going on with technology and research, and the meeting that I was at at the FDA was the physicians and the medical people in the field that are working every day refining some of the treatments. The two biggest treatments are clips and coils, and then there are stents now as well. So people are looking at combinations of those, just different variations of them, and to have to go through the process that's been ongoing at the FDA to get these things put through. It's really a long process, and obviously we need processes in place, and we want to make sure patients have a product that is good and secure. But what's happening now is that the U.S. is manufacturing these products, and they're being shipped overseas into Europe and Australia and China and other countries, and they're using them on patients, and we're about eight years behind. So we're just trying to speed that process up to give patients and their families the most options that doctors can present to them.
This is BNN News, and we're talking with Christine Buckley from the Brain Aneurysm Foundation. Christine, you're also concerned with what it's like to be living with an aneurysm, not just as a person who has it, but as the family member, getting the support for people. Talk about how your organization helps with that.
Yeah, I mean, when the foundation was started back in 1994, and it was formed here in Boston initially, and it is a national organization now, that was the premise of why the organization was started, to support families and patients and their families, because people, even now, it's the awareness function of what we do. People don't often know what a brain aneurysm is until either they have one, someone's lost a family member, or someone's helping that family member through the recovery situation, that journey of recovery. And it just totally upends a family because, as I said before, about 7 out of 10 people who survive an aneurysm rupture have some form of disability, and most often times these people are not able to go back to work and resume the normal course of life. So it's really difficult on a whole family unit. Affects society and people not being able to go back into work and be, contributing to the society and be part of the workforce. So there's a lot of components to it.
Another thing that some of the people you just mentioned have to do is advocacy. You have an advocacy day in the State House. What's that going to be like? It's
going to be great, actually, and it's nice to be here because I got out of my office with there's a lot going on still for the last minute prep. So we're traveling to DC Sunday. We have a prep meeting Monday, and then Tuesday we'll be on the Hill. We have over 80 people coming from 20 different states to participate. It's about our 6th year going. We're fortunate to work with the big law firm, Arnold & Porter, who provide us pro bono services, and we have 2 big asks when we're on the Hill. And we started out really just providing the education and awareness. So I just found out yesterday that Congressman Lynch of Mass, along with Congressman Joyce of Ohio, just presented a resolution to make September National Brain Aneurysm Awareness Month. So it's great to have, it's House Resolution, I think, 783, that just became over the desk recently. So that's great. And survivors and family members love to rally around that. But even greater than that, we also have a legislation out there called Ellie's Law, and that's a law that was put in place for a young girl, 14 years old, who died of her second day of high school. So with that, we're asking NINDS, which is a part of NIH, for $5 million for 5 years for brain aneurysm specific research funding. Because right now the government only spends 83 cents per year per person affected by the disease on research. So it's very underfunded in comparison to other disease states.
You're also giving recognition to some of the people who've been helpful. You get a couple of champion awards you're giving out pretty soon?
Yes, so after we come back from the Hill, we have a quick turnaround, and then on March 30th, a Friday evening at the UMass Club in Boston, it'll be our second year doing this champion awards, and it's to recognize people in our community who've really helped us raise the level of awareness and education about this disease.
And I think one of them is Governor Baker.
Yes, Governor Baker has become one of our champions, as we like to say, and he really stepped up last year. September's our awareness month, and he had a day at the State House in recognition of brain aneurysm awareness and education. He is a friend from his high school days who had a brain aneurysm, and he's recently been touched by some other people in the community, so he's been great in working with us and helping us locally raise the level of awareness.
Well, one other thing that's going to raise awareness and some money, I would imagine, you have a fundraiser coming up in April?
Yep, April is our, I think, 16th or 17th annual Arterial Challenge, which is a 5K and walk that begins and ends at Fenway Park. And yeah, we already have people with their team set up. Registration is live. People can go to our website, bafound.org, to sign up or to donate. But it's a nice, actually, family event as well, because people can go inside the park, and we are on the third base side, and we generally have the trophies there. Wally comes around. We have a band. So it ends up being, weather permitting, a really lovely day and a great gathering. We had almost 1,000 people there last year, so it was wonderful.
Thank you very much for being with us.
Oh, thank you, Chris. I appreciate it.
Christine Buckley from the Brain Aneurysm Foundation.